Here at ABC Action News, we want to take action for you. Many of you are unhappy with your health insurance coverage. We've been listening to your frustrations, and we're looking into why so many medical claims are denied.
It is part of our new special coverage that we're launching tonight called Patient No More. And the woman you're about to hear from could have gone blind if she did not get a miraculous treatment to save her vision. But a year later, she was left with a bill that could have left her bankrupt.
I think a lot of people just give up. And that's why they lose their homes. And that's why they lose everything, because they're saddled with bills that they cannot pay.
After months of fighting her insurance, she reached out to us and our consumer investigative reporter, Susan El Khoury.
I close everything.
Every day, Sharon Lawrence follows a morning routine.
Look at the difference of light.
That's anything but routine.
It's like being in a tomb.
Even a dim view is better than what she's up against.
It becomes very precarious. You could go blind.
She thought insurance covered the treatment to save her vision.
The request has been approved.
What she didn't see coming was being left with a bill for more than $373,000.
What was going through your mind?
That's more than the mortgage on my home. Where would that money come from?
About a year ago, Lawrence was on vacation in Cabo when the first signs appeared.
I had very severe double vision to the point where I was dizzy and I could hardly walk.
Doctors diagnosed her with thyroid eye disease. The outlook isn't ideal.
The eyelids retract, and so the eye doesn't close.
That explains Lawrence's look.
Well, I can.
But she'll clear up any confusion.
I don't look the way I used to look. My eyes were burning and watering 24 hours a day.
She says her doctor recommended 6 months of an infusion treatment with a drug called Tepezza.
And it's an extremely expensive infusion.
Her insurance, Anthem Blue Cross and Blue Shield, sent not one but 2 letters of approval and called the procedure medically necessary.
I just assumed it was all set.
Turns out the provider who gave her the infusions wasn't all set.
They hadn't been reimbursed for any of the infusions, none of the 8 infusions.
How much was that bill for?
$373,833. And they said to me, as gently as they could, if Blue Cross does not pay this bill, you are responsible.
What followed was weeks of Lawrence trying to find a way to see what went wrong.
So this is my little one.
And spending hours on the phone between her insurance.
Hi there, my name is Sharon Lawrence.
The provider and the companies they contract with that she'd never heard of until now.
This process definitely puts the patient last.
You typically think of your healthcare being between you, your provider, and your insurance, but there are other companies that come into the picture. In Lawrence's case, she's covered by Anthem Insurance, but a third party, Personify Health, administers the benefits. She says she kept going between the different companies, trying to figure out how an approved treatment now had payment denied.
Our healthcare system is broken, and the insurance companies have all the power.
Do you feel like that's right?
No, it's absolutely not right.
Both Anthem and Personify turned down the chance for an interview. Even though Anthem approved Lawrence's treatment, the company said Personify was responsible for processing the claim. Personify said the denial was conditional, pending further review.
This happens more and more, and patients are very frustrated.
Dr. Jay Wolfson is a University of South Florida professor with expertise in medical ethics and policies.
There should be a better way. You're dealing with a remarkably complex, convoluted system. Most of us don't have the time and energy to understand it. Many of us in the business don't understand it very well.
He says you can't overlook the big money involved in health insurance.
They take money and they don't just hold on to it, they invest it. There's an incentive if you're receiving funds that are intended to be used to pay for claims to not pay them as soon as they come in.
Lawrence couldn't afford to keep waiting. Her provider had the unpaid bill in collections.
It was frustrating, infuriating and scary.
Days after I reached out, Personify said the claim was now approved.
Thank you so much, Susan. I'm so grateful.
Yeah.
So appreciate you. I could not protect myself. I could not intervene. And I couldn't get anywhere without your help.
Still surrounded by darkness, but finding some light.
I am feeling so happy, so light, and ready to take on the rest of my life.
And Susan joining us in the studio right now. That was no small bill, and I think people watching this, there's got to be, some frustration here, because not everyone has a consumer investigative reporter on their side, and you call and they just approve it and make it go away. I mean, that's pretty revealing.
Yeah, and that was one of the things we heard just in talking with her. I mean, she spent weeks before she even called us reaching out. She showed me the entire list of the different people she talked to. She'd written down all the reference numbers she had. And she's going between two different companies here, trying to figure out, who do I talk to? Who's the right person? And it did take us getting involved and elevated to the right person, and it got resolved pretty quickly.
You got on the phone, you got results, and now she's happy with the outcome.
Yeah, but so many other folks out there are in her shoes and unfortunately don't get that. So you guys are doing a series of these kinds of reports, right?
We are, because we think it is something that's important. We're hearing the frustration, and I mean, you're not talking about, small amounts here. This is a lot of money for people, and concern over how are we going to get our health care taken care of, as well as just paying for it.
Right.
They need a voice, and we're giving them a voice.
Yeah, that's great. Good stuff, Susan. Thank you.
Susan, thank you. All right, well, Susan, and by the way, if you'll hear more of these stories, just like who you just heard from over the next few weeks through our iTeams Patient No More series, we just launched it today, investigating claims that have been denied, and will bring you useful information that gives you really the best chance to get your medical claim approved. Look for those stories in the coming days and weeks right here on ABC Action News.